Afternoon. I said good afternoon. We respond in the household I was raised in, child. So welcome. Thank you so much for joining us today for this showcase, this true honoring of the work and passion and dedication of public health workers that never get their shine. So if you don't know anything about me, first of all, my name is Dr. Mati Tlatchwire Davis. I'm the Director of Health for the city. And I'm just a permanent cheerleader for the people that do this work day in and day out. So that is why we're here today. We're also here because if you drove downtown in this heat, you get to be fed. So we will eat and we will fellowship too. This showcase is to really honor the work of our inaugural Behavioral Health Bureau, the work that has been done since we launched just 8 months ago. A lot of you behind these cameras were here with us then, to better address mental health and substance abuse services in our city. Joining me this morning to offer some remarks are the Honorable Mayor Tashara Jones, Dr. Julie Gary, the Department of Health's inaugural Bureau Chief overseeing the activities of the Behavioral Health Bureau, and Dr. Scott Timms, Project Director for the CDC Foundation, assignee to the City of St. Louis Department of Health, and because he won't say it, the true leader and reason that we have all the deliverables that you will hear about today. Last but not least, my partner in crime, who will not be speaking because she chooses not to, but she is truly my partner in everything that I do, the Commissioner of Health for the City of St. Louis, Victoria Anwori. All of the speakers will make the remarks, and then we'll open it up for questions at the end. So, I get to be a proud mama bear. Today we launch the next phase of our Behavioral Health Bureau to begin taking the work from the past 8 months of study, of assessment, of collaboration with more than 100 stakeholders who helped to sharpen the Bureau's focus, moving us toward even more significant action and impact. That work is rooted in ensuring improved and sustained access to mental health care, which includes non-stigmatized access to treatment for substance abuse, specifically opioid abuse. Mental Health America, a national nonprofit dedicated to the promotion of mental health, ranks Missouri at 44 out of 50 for mental health for adults, meaning that our state has a significantly higher prevalence for mental health illness and lower rates of access to care. We're quite literally in crisis, have been in crisis, and this crisis has been exacerbated throughout the history of one of the biggest pandemics in the history of mankind. Too often, individuals are left with the task of finding help on their own, or with limited assistance to navigate the mental health care system. The Behavioral Health Bureau now exists so that no one has to take that journey toward wholeness alone. By advancing a collective societal approach to building mental health, the Bureau marks our collective responsibility and commitment to generate and sustain innovative resources that will aid in the healing of our communities, enabling us to take better care of one another as good neighbors, which really should be what we do every single day. So the fact that we have to have a party, put on cute suits. I got makeup done for y'all today. I'm in heels. Heels. I don't even do heels like that, right? But we're doing this because of the crisis within a crisis. Because for too long we've seen that crisis impact those of our brothers and sisters in North St. Louis, parts of South St. Louis, and just blocks from this building. For years, for decades. I have staff who chose to come to this launch today, this second phase, because they live in those communities. They were traumatized in those communities. Then they took jobs in the cities with wages that don't really honor that work that my mayor and I inherited, that she is fighting so hard to increase and to support them. And now they're in those very communities healing their families. That is something to be proud of. But shame on us for needing to dedicate policy and funding and intention for something that should be a basic human right. I went off key, y'all, so I've lost my place. We just gonna flip through the notes. So The press may be wondering, why am I back here? You brought me here 8 months ago. What are we talking about? Well, we're going to talk you through a specific deliverable, bringing in a national level of experts to build a strategic plan, an implementation plan, a health equity plan, a data dashboard, and multiple other resources for the city at not one extra cent to the taxpayer of the city of St. Louis. They are leaving us now, having trained an actual bureau that never existed of people born right here in the city to now do this work in real time. So that's why you came back. We could not be where we are today without the work of this team from the CDC. Please stand. All of the members of the CDC, go ahead, stand. You knew I was going to do this, child. I don't know why you're surprised. We have Scott, we have Bonita, we have Rhea, we have Anu, we have Sherilyn in the back, Ms. Avis, who is joining us from the CDC Foundation. This work and this partnership that you see here is this group of people use their knowledge, use their leadership to connect with our community and help the Department of Health evaluate the needs and the goals necessary to address the needs of this city. But now, we do have, okay, y'all can sit now. We now have, over the past 2 months, worked towards a transition to our City of St. Louis team. Several of them, like I said, born and raised right here in the city. Some of them still living in the very cities, in the very communities that they'll be impacting. Please, can you all stand? They are ready and eager and trained at the highest level by these national CDC partners of ours. I said last October when we first launched that behavioral health bureaus that behavioral health was one of the top 3 non-COVID priorities for both myself and the mayor. I am proud to have our honorable mayor by my side today as we begin the next phase to bring equitable access and resources to our city through this bureau. Her commitment to working with the Department of Health toward our goal of launching this bureau and the important work it is doing is just one of the ways that we are making St. Louis even greater. So, with that, I'd like to pass the microphone to the Honorable Mayor, Tishaura Jones.
Thank you, Dr. Mahdi. My heart is full today because when I became mayor 2 years ago, our health department needed a lot of love. And when I found Dr. Mahdi and she agreed to come work with me, I don't say for me, I say with me. And I see the strides that she's made in the short time that she's been here. This is the kind of health department that St. Louis needs and St. Louis deserves. So can we give Dr. Mahdi another round of applause? But also, as I think back to this time last year when we were awaiting approval from the Board of Aldermen to pass a budget and send it to my desk, I was eager to get it done because we boosted funding to the Department of Health to establish this bureau, knowing that there was a critical need to improve access to mental health and substance abuse. St. Louis has the highest prevalence of mental health-related emergency room visits in all age categories compared to St. Louis County and counties across Missouri. And drug overdoses are the #1 leading cause of death in Missouri among those 18 to 44. St. Louis City faces the highest per capita rate in the state. Residents across our city see firsthand in their neighborhoods the human cost of failing to invest in behavioral health care. Addiction and lack of access to mental health care are the root causes of crime, and we can work to address them before they result in a crisis, emergency room visit, or as we saw in October, worse. That's what we mean when we say crime is a public health crisis. I'm grateful to stand here and to witness a forward-thinking strategy from our Behavioral Health Bureau that will make our city safer in the long run. Promoting behavioral health awareness, effective preventive measures, early detection and treatment improves physical and community health. It makes our neighborhoods healthier and safer. We know this issue is not unique to St. Louis. This is a regional problem. And so I'm grateful to our Department of Health under the leadership of Dr. Mati Shlachwayo Davis for emphasizing a regional approach to public health and public safety. Thank you to Dr. Motti, Drs. Julie Gary and Scott Timms, as well as our public health and public safety partners who are committed to this work and protecting our residents and getting them the support that they need. I'm looking forward to hearing updates on your work and how we can continue to support St. Louisans in their time of need. Thank you all, and God bless.
I let out a smile, because find you a boss that learns how to say your very long, very complicated last name like she was born in this very same country, although she wasn't. That made me smile. Thank you, Mayor Jones. I'm really proud now to say that we will now hear from Dr. Scott Timms, the project director for the CDC Foundation, assignee to the City of St. Louis Department of Health. Dr. Timms led a team of public health professionals and heroes, might I add, who assisted us with laying this foundational groundwork. I got a lot of flack from just a few people about, why did you bring these people who aren't from our city into our city, and why are they here, and we know what the city needs. And people need to understand that if you're tired of the turnover that happens every time we have a new mayor, although we're not going to have a new mayor for a while, period. If you're tired of the leadership turnover that happens whenever that happens, you need to invest in foundational work. If you don't want to do another listening tour, come to another foundational meeting, then this year's work was critical. It was critical to put together a strategic plan, a foundational implementation strategy, so that long after I leave, and I'm not conceived of, which hopefully won't be for a while either, right, that this work will continue. Never again must this work be dependent on the person who is wearing these heels or standing at this podium. This work must continue because the people need it, and that is why we needed a plan that would root us in this work and allow whoever is in leadership to continue us in the right direction. I can think of no greater leader to do this. What you will not see in the presentation that Dr. Timms gives you is the amount of personal and professional barriers he had to overcome. The things that happen in HR, child, when the money goes away and it comes back in, when people attack you because they have their own baggage from years and years of disinvestment, which is valid, but how he always centers community and team and always brings things across the finish line. I have never worked with a leader like Dr. Timms, and this city was so, so incredibly fortunate to have him. Dr. Timms.
I hope I can present well enough for that intro, so thank you. I'm super excited, and I have a very little bit of time to talk about a lot of things, so I'm going to be very fast. Also know that my slides have lots of words that will be emailed out to you shortly this week, so you'll have links and copies of all of this. My name is Dr. Scott Timms, and I have been the project director for the last 9 months, and I want to recognize my team that is here and that we are part of the CDC Foundation, which is a cooperative agreement. And so my team, if you'll wave one more time, these folks have done all of this work. It was not me alone by any means. It's a village of work here, and there used to be a lot more of us, I will say, so we did a lot of work for folks who couldn't continue with us for 9 months, which seems like a long time. So we promised 4 big deliverables last September. One was a comprehensive map of services. We were going to have a data dashboard. We were going to have a strategic and an implementation plan, as well as a health equity roadmap at that point. I can say that you're going to see all of that today. We have all of those parts and pieces, maybe not completely finished, but they will be by June 30th, but I'll be able to show you a little bit of all that today, which was super exciting. And again, the 4 folks that you guys saw raise your hand today really did the multitude of this work, and I really can't praise them enough for the time and the effort that they did. So stage 1 was last fall. This was our community engagement piece. We did a community assessment. We recruited. We began that process of getting these 5 new behavioral health staff, and there are more people coming, so just know that that's there. We actually interviewed and hired these folks. I'm going to take some credit for getting the right folks at the table here, because it was a really tough thing. I interviewed, I think, 60 people for these 5 positions. We also developed Google Maps of all of this, and I'm going to be able to actually show you interactive versions of some of these deliverables deliverables today. We were also part of the crisis from the school shooting, and we did about 100 meetings in those first 2 or 3 months that we were here with community partners and agencies. So we've been super busy. So a lot of you I recognize from Zoom, but I don't know you because it doesn't translate in person to Zoom. So just sort of know if you've seen me, say hi and remind me what Zoom meeting and I might know. But know that this was our first 2 or 3 months of work, and this was a lot of deliverables. As you look at it, the mapping project was significant. We have created Google and Tableau maps showing locations, treatment centers, recovery. These are all available. We also have Narcan availability maps. This data is somewhat limited in our maps simply because what data is available to us. We don't know every Narcan location, but we're hoping in the future that that will be something the new Bureau will be able to do. But these are all accessible and easy to access maps for resources that anybody, anywhere can find and access. Our stage 2 was really our deeper community engagement, and this began our strategic planning task force work with the SOS. How many of you were part of an SOS meeting at some time or another?
Thank you.
That's where I knew. Thank you. I was told that people would not participate in strategic planning because that was something St. Louis didn't like to do, but I'm telling you, our coalition meetings always had people. Every sector that we had. And so we broke strategic planning into sectors, and I'll show you what that looks like, but that group came together, did significant work, and really gave good feedback, which led to the development of our strategic plan, which is available online, and you will see a little bit of today. We did over 100 task force meetings, and Benita was at every one, and Benita was our strategic planner. I facilitated some, Ani facilitated some, Sherilyn facilitated some, and Rhea too. We all took turns facilitating, documenting, and doing those things, and it was huge. Our Narcan project was Ani and Rhea, our 2 data folks, who really took Narcan data, created a presentation, and we have live Narcan maps. So we can see where overdoses are happening, where we know Narcan is, so we can now target interventions to get Narcan into communities where it's not. That's huge. That is a game changer for preventing overdoses and deaths. We also have a data dashboard template which you're going to be able to see. So we've been able to take a lot of publicly available data, put it in a place so that it can be used for program planning. And this is stuff that we finished January, February. So again, not a lot of time, but we got a lot of deliverables for you in that short piece there. Community engagement, I want to mention just a little bit more about the task force. I'm sorry. We started by breaking this community into sectors so that we would have different groups and broad representation in our task force. And we started out with, I think, 4 or 5 different groups. We ended up with about 7 sectors, I believe. Lots and lots of work there, but we had representation across the board providing input into this, and I say it was really important. This picture was from our first visit here. We look really excited because we weren't so tired as we are today. It was a good time. So again, this was the naloxone map that we did, and we were talking about that. I'll call out our friends from Prevent Ed who were showing us what a nalox box looks like because we'd never actually seen one of those in person, so it's really exciting. Stage 3, this was really our March till today piece. We provided the onboarding and training for new Bureau staff. We actually spent a week here teaching, training, doing. We had maps and worked for them when they started before we got here. We have delivered a strategic and implementation plan to Department of Health. We also have a health equity white paper and toolkit that Dr. Duckworth did in the back. Dr. Duckworth, and that's going to be released later this year with the DOH equity plan, so that will be a behavioral health piece that will go there. We also work to coordinate 3 RFPs that will provide the funding for agencies. So we heard a few things when we started here, and I'm going to talk about those here in just a minute, but these are the objectives by sector. We talked about the sectors in our strategic plan, and you're going to see more about these things today, but these objectives really represent what the community told us needed to happen to address opioid and overdose here. And if you notice in the middle, this was centered around equity. And that was really key throughout this work. And our strategic plan actually addresses equity in relation to every goal and objective that we have. So again, really good work here. You have a copy of this in your hand today, and it lives online. These are our community-driven strategic goals and objectives. We were very focused on making sure we built a system that supported what the community want, and we left a roadmap behind for the new Bureau to do this work. Now, the Bureau staff have an implementation plan that gives them basically what we thought was the step-by-step to get this work done. So it's a 41-page document. I'm not going to talk about that today because it's way too long, but it is here as a roadmap for the future of the Bureau, which is super exciting. So you can scan this QR code. I'm going to show you really quick what it looks like, but I want to talk about the 3 things that people have complained about or said that needed to happen. One is a sustainable structure for DOH to continue this work. We have done that with the new Bureau staff. They are trained. We have left them directions. They have step-by-step. It's there. We have hired the staff to do that, so people wanted structure here. It is here now. And then people said, where's the money? 3 RFPs that we wrote, we coordinated getting those out, and so thanks to the efforts from a lot of people, funding became available, and we have pushed that out to community agencies, and so folks are going to be getting money to actually do this work. So I think we delivered in 9 months a whole lot of things that are going to be really helpful to the community, and I hope that you feel that way as too. I'm going to go to my laptop and show you guys a few web pages really quickly so you can see where you can see all of these materials online. So if you scan the code, you're going to go to a page that looks like this. Each of these tabs will take you to different things. There are 3 different database dashboards with St. Louis data. You can filter and look at this in different ways. Just scroll down. This will also all translate to the city's website at some point. We're in that process. But this data is now available. So if you're applying for grants or you need to know what happened where or you want to plan targeted interventions, we've made this data easily accessible. This is medical examiners, law enforcement, and some city data that we get as well. So anyways, this gives you data that was not easily available before our project. The next piece, if you click on it, you can actually make it that big. It's built in Excel, which makes it a little bit easy to cut and paste if you need to. These are our naloxone access maps. You can look at this by limited English proficiency. You can look at racial demographics. But this shows you where we know Narcan is and where we need to get it. So again, all of our community partners that have Narcan, think about how you can get this out. There's also a presentation about how we came up with this data and things that can be used as well. If you look here, we've talked about all the agencies that we met with. We have actually compiled all of the agencies. This first tab in this resource is actually all of the data dashboards that exist from different agencies in the city. So you can go here and see different data that we didn't have, that people have already done this really well. You can see all the community services we found. You can see where the 12-step meetings are. You can see where you can drop off drugs. We have provided the most comprehensive set of resources here that you can use in any way that you want, and we can constantly update this so that the city can use it in different ways. We have also created Google Maps that show you all of the behavioral health services available by type. You can see this. You can look for detox, medication-assisted treatment. This is a Google map that the new Bureau has been trained to maintain, but if you click, it adds, it's done by neighborhood, which was really important to the city as we were talking about data. You can click on these, it will tell you what the agency is, what they do. This again is new infrastructure that should make access to care and different services really easy for people who maybe don't work in behavioral health. This is the strategic plan that I just previewed for you. If you click it, you can see the entire PDF, all of the pages, all of the information, all of our values, everything. It's here. We have provided this for you. It is an easy, accessible resource. I hope that you guys appreciate and are able to use this in the way that we have hoped. It has been such a privilege to work with the city of St. Louis. So I'm going to stop there because I probably went over my 7 minutes. Thank you very much.
Y'all didn't know you were coming to school today, huh? I'm so proud. Because one thing about me, like, I talk. Everybody knows I talk. I'm losing my voice today. This is my 4th speech that I've had to give today. But we do the work, and we keep a receipt. So for all of you that asked, what was this for? Why was it for? My good friend, Dr. Corey Bradley, says data is justice. You cannot do any work. You cannot help communities without knowing the how, the where, and the why. And that is how we chart forward. So now, with that being said, it is my distinct pleasure to come to our final speaker before we'll take any questions, Dr. Julie Gary, who is leading our Behavioral Health Bureau right here as its chief. Dr. Gary brings a wealth of experience. Not only did she spend 13 years serving in active duty in the United States Army, deploying to 8 countries over 2 years, before completing her service at the VA John Cochrane Hospital. She was an epidemiologist here. She wrote the first draft of the first ever health equity plan for the city that we'll be working with our partners, the Regional Health Commission, to bring to completion. Angela Brown, the leader of the Regional Health Commission, here with us today. Thank you for your tireless work and service and partnering with so many of us in the community. But what I love most about Julie is it doesn't matter how bad it is in the Department of Health. Child, I could be ripping and roaring, mad as hell, just really frustrated by something, Julie just smiles and she'll say, "We got it." And they got it. She is passionate. She loves this community. She loves this work because for her it's personal. She is a mother, and every day that she comes to work to do this, I know personally that she cares about this because she wants this for her girls. I'm so proud of you. Come tell them what we've got going on, Dr. Gary.
Good afternoon, Mayor Jones, Dr. Motti, most importantly, citizens of the St. Louis community. I want to thank you for this opportunity to serve you in such a critical role. You can read about my background in the booklet today. I don't want to talk a lot about that, but I do want to talk about 3 things that I do want you to remember about me, and that is that I'm a veteran, I'm a widow, and I'm the mother of 3 biracial children, one who is in the back today. Jordan, thank you for being here. And those probably are the most 3 critical things about me to remember that make me good for this job. I am an epidemiologist by trade, so I am going to hit a little bit of data here for you. The mayor hit the first bullet, so let's just go to the second one. We have an epidemiologist, Megan, who puts together a monthly report. She's the one who will be supporting me. I did that report previously. So let's look at suicide attempts and suicidal ideation as of April. Most of those patients in the data that we see there are males and Black patients. And then we look at emergency calls due to mental health concerns. We're talking about age 34 to 44 males, and most of them are coming from the zip code 63103. And then going on to the next slide, looking at data, we've got emergency calls due to overdose, which is our most critical component of mental health right now, and the focus of the OD2A team, who I want to thank tremendously for all the work they've done to set us up to be in such great position to do this work. Those were ages 25 to 34 and males. And then when we look at fatalities for overdose coming from the EMS data, we're talking about ages 35 to 44, males and Black drug users. And then when we talk about drugs specifically, and you see this across the country, fentanyl was involved in 88% of our overdose deaths between November 2022 and January 2023. So let's look at, when we're thinking about doing this work, how we might do it in a way that's effective and that feels good for the community. These are challenging times. These are challenging issues. And so how do we address those in a way that is healing? That is the most important part of this. And so the vision that we have around this work is to pursue the holistic healing of St. Louis families and communities. So it's about our kids, it's about our mothers, our fathers, our single parents, our communities as a whole who have a strong history of some structural problems that have caused some of these mental health issues. And so we want to give them the highest optimal mental health and well-being by removing some of the barriers that they currently face. So how do we do that from a mission perspective? We do that by strengthening relationships with some of the community partners that we have in the room today, whether it's strengthening that relationship between us and you or between each other. We also strengthen resources. Dr. Timms mentioned money flowing into the community. We want to see that money used in places and with partners that are already doing this work for our great community. And we want to educate. We want to promote awareness, availability, and equitable access to culturally competent behavioral health options. So not just, hey, I can get to a provider, it's, hey, I can get to a provider that looks like me in the neighborhood where I live. And most of all, I talked to you about my history, my personal history. We want to do that with grace and compassion because we just don't know, as we're talking and connecting with people on a daily basis, the loads they're carrying and the things that they're going through in their lives. So what are we going to do in terms of priorities? Well, internal and external partnerships. There are certain city organizations right now that we could be working closely together with to solve some of these problems. So things like the criminal justice system, the Office of Violence Prevention. We should be working closely with those offices to move this work forward and to design our programming to make sure it's effective. We're also going to do staff development and training, not just with my team, who I absolutely love so far. I'm going to talk to you about them a little bit in a minute. minute, but training other departments across the government to make sure they understand if somebody walks into their office looking for a resource, they might just not need a resource. They might need behavioral health attention as well. Data, we've already spoken about that. Equity, a huge issue when it comes to healthcare across our city. And Dr. Mahdi mentioned an equity plan coming out later this year. I was instrumental in doing that work, and we'll make sure that happens in the Behavioral Health Bureau. And probably one of the most important priorities on this page is transparency. We know how trust is in our community. And so doing this work with our community partners requires transparency so that we increase the trust that the citizens have for our government and for the behavioral health work that we're doing. Community education, and then finally linkage to care, and we'll talk about those two here in a second. So my team, they're all right here in the front. Ladies, can I have you stand up again, please?
Turn around so they can
Yeah.
see how good you
So you can sit. You can sit. Okay, so 3 of them came from internal positions in the health department. Tammy McNeil has a master's in social work. She's going to be doing linkage to care in our peer advisory groups. And then we have Denaro Mack. She goes by D. She's going to be doing our Narcan distribution program and community education. She's been phenomenal in just designing education pieces so far, so I want to applaud her for that. Valerie Newbern, she came from our communicable disease department. She's going to be leading us on our first community event, which is going to be Pride here coming up in a couple weeks. She's going to be working on our coalition of community partners, and then in just strengthening community partnerships in general. And then our last but not least by far is my secretary, Samaya Rocket Morgan, who was a former St. Louis public school teacher, so has a lot of experience in the community. She's going to be doing communications and community outreach. So I applaud them for their work so far. They are excited, they are compassionate, they are doing this work with grace, so really excited to kind of see where they go here in the future. All right, our initial progress, so I'm on day 27, just so you guys know, day 27, we're at a press conference. Day 27, and we've made quite a bit of progress in 27 days. So we've sent our staff through mental health first aid training. They're also gonna be going to peer recovery support training here in a couple weeks. We have established our Narcan inventory. We have promotional items that we'll be giving out at events like Pride. Probably one of our biggest developments, which was had input from every one of my team members, is something that we've seen as people have called in or reached out to us. We want to make sure we can connect them to resources or community partners that answer their phone 100% of the time or 99% of the time, and that have beds available, and that we can connect people to immediately. And so we developed this phone reference card to go next to our phones, and that hopefully will be across our health department and maybe further across the city. As people call in and they need resources, we have this reference card that we can look at quickly and say, hey, I'm going to connect you to here, or hey, dial this. And this will also be out on our website as well. We have a mobile outreach van. You'll see a picture of that in a moment. So we're going to be appearing out at community events. So if you have something going on and you want us out there educating and distributing Narcan, touch base with me later today. But you'll see a picture of that in a minute. Super exciting about that. We have a monthly behavioral health report, and that analysis is done with an equity lens. You saw some of those statistics on my previous data pages. And then we've done internal and external partner meetings. So things like working on the Criminal Justice Committee, meeting with some of the community partners that are in the room, and then other tool development. So things like phone scripts, outreach cards, education cards that Dee has designed for our Narcan distribution to quickly educate people on how to use it. So that's some of our initial progress. And these are some of the things that we're going to be doing. So education and training with community partners. We're already talking with the public schools about when the school year starts, what kind of education they're looking for. Scott mentioned our RFP process. We have some applications that just came in, so we'll be reviewing those for funding. We'll be doing Narcan distribution at all those community events. Valerie will be coordinating that coalition, and so we'll be reaching out to community partners who have participated in meetings so far, or others that now want to participate, so that we can be efficient with our resources and our time to address some of these issues that we're seeing in our community. The mobile outreach van, you see a picture of it on the top there. It now is wrapped in a City of St. Louis logo. So we'll be out at community events, kind of representing healing, talking to people about the things that they need where they live and work. And we'll also be hiring and training additional staff. So we have a team of 5 right now. We have 5 more positions open. So if you're interested in working with us or know somebody looking for a job in behavioral health, I'd love to talk to you about where they might fit best. So that's it for my part of the presentation. I'll open it back up to Dr. Motti.
So you've heard a lot. A lot of times these events are for people to look good and give you a lot of fluff to detract from what's going on. So let me be very clear. We had a mandate, and through the leadership of Dr. Scott Timms and the CDC, we met that mandate and quite frankly surpassed it. You asked for available from the city, by the city, folks to do this work. We have delivered and we're hiring in real time. We know the deficits that the city has, right? We know that we're not the county. We don't have the budget. We don't have as much clinical services, but we are quite realistically filling in real time gaps that don't exist in our city. We will be bringing healthcare to your doorsteps, literally. We will have vans, we have 2, we will be driving them into your neighborhoods. We have money. We know some of you don't care about this stuff. You want money for your organizations, and you want it in a way that is easily available to you. We have over 10 applications that we will be funding for community organizations that have done this work, and they will get the funding that they deserve. I'm looking at you, Kamel. I'm looking at you right now, girl. You have done this from your basement. You have built recovery homes across the city of St. Louis with no funding. And you have been patient, you have been a participant, you have been a part of the solution. You could have complained about how the city has failed you over and over and over again for years, but you showed up, and now we're gonna get some money in your pockets. So we are bringing money to the community. So I will stop there and happy to take any questions at this time.
Real quickly, if we can limit our questions to about the Behavioral Health Bureau's announcement today, we would appreciate that. And we really only have about 5 or so minutes for questions. And it's open to all questions.
I'll go ahead, Kelly Basically, Fox News. Can you talk about how important it is to have, well, talked about it already, but how important it is that the public knows that these services are now available?
It's so, so important. I was frustrated along with the public when they kept saying, you announced this bureau, but where do I call? Who is gonna come if I need help? And boy, did I understand that frustration, but we needed this time to build a sound house, right? I could have easily made this flashy and hired people quickly without a sound foundation, without a really good plan, and without the trust of our community partners. We've never filled a room like this. These people came on a Tuesday during the week. They all have meetings. There's a bunch of CEOs and really fancy people in here, child. Okay, but they came because they joined us in this journey. They joined us in this work, and they believe in this work. They want to work with us. That means more than me putting someone on the phone in August of last year without a sound plan. But I'm most proud, that's why we're back, for the community to really understand now there's a number you call. Now Samaya answers, and Samaya is trained, and Samaya has a 4-page resource list to link you. And Samaya has behind her the might of 100 organizations that have been meeting with us consistently for the past 6 months. That's a powerful plan. That's a plan that moves things forward. It was hard for me to localize what the problem was, because the more I met with community leaders, the more I was like, there's so many good leaders in the community that are doing amazing work. So why aren't we moving the needle forward? And what it is that there's so many, but they're in silos. They're in silos, they're in silos. And they're also overwhelmed. They don't have the capacity to collaborate in a way that's sustainable. So that's the gap that my department and my position must fill. We must be the coordinator. So to show you in real time that we've been able to sustainably have people upward, up 100 organizations meet consistently, that shows a more coordinated approach. And it's not gonna change the metrics immediately. It's not. I had to, you can tell, Chad, I'm a type A personality, plus, my husband will tell you, right? So I want to see things move quick. I want to fix things for people quick. That's my passion. That's who I am at my core. This type of work, I move the needle. But the more the needle moves, and the more the needle moves, the more we help people. So, St. Louis, you have a number you can call. You have help. We will help to coordinate. Give us time to grow. But there are real resources in real time available now. Does that answer the question? Okay. Dun, 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 dun. All right, listen, we must have done a great job, but y'all tired. We either did a great job or y'all are hungry. I will take it. There are so many people to thank. Today, I started off the day speaking on radio, keynoting at Johns Hopkins virtually, keynoting at a conference down the street. I haven't even been here to see what this room would look like. So for this to happen, there is a team of incredible leaders that cares that things look the way they should feel for you. And so Kimberly Vanderberg, our supervisor for the new Communications Bureau, has been working her butt off for months to make sure this can happen. Julie, Scott, the entire CDC team, our entire behavioral health team. Can every person that works for the health department that's here today please wave? All of those people have helped carry things, look at things, proofread things, keep these people sane. So I just want to say a huge thank you. Mayor Jones, thank you for caring about public health. Thank you for caring about behavioral health. Thank you for investing in us. And all of you, thank you so much for coming today. It makes my little heart happy. Thanks, everybody. We're going to have food and refreshments in the new offices on the 4th floor, so we can mingle and talk, but you can make your way up to the elevators, up to the 4th floor. There'll be people to guide you, and there's food, and you can see what these folks are doing their work in real time. Thank you so much for coming.